Okay, if I'm actually more than 6 feet away from everyone, I'm going to take this off. So today I'm going to walk through all of our data and answer any questions you might have about any of it. May I have the next slide, please? Now, public health doesn't get a lot of conspiracy theories, so when we actually do get one, it's pretty exciting. And this one is about the definition of a COVID-related death. Now, if I told you that a death was COVID-related, any normal person would be like, COVID caused the death or is related to the death. For some reason, our federal partners have made a definition of a COVID death that is essentially, if you had a positive COVID test and then you died for any reason within 60 days, it counts as a COVID-related death. Why? Completely unclear. But that is not the natural definition of what we count as a related death in public health. May I have the next slide, please? What we count in public health is the true definition. So this means a board-certified forensic pathologist or a physician listed COVID on the death certificate as having been related to the death. So what a normal person would consider COVID-related. All the deaths reported in Washington County, 21, we had one this morning and the death certificate isn't signed, but as of yesterday, 21, all 21 of those deaths were truly COVID related. So the numbers that we are giving you are the more traditional definition of COVID related and not using the federal definition of COVID related. Does that make sense? No?
No.
Okay.
Thank you, and thank you, Marty, for bringing that issue up. My comment was I get lots of questions like all the rest of this board does from constituents and others. And it was reported in some states that if someone died, it could be a motorcycle accident, it could be a heart attack, could be pneumonia, it could be anything. And they tested them then at that point, and they were COVID positive, that the death certificate would list COVID positive. And then that's the question I asked of Marty, and she said, no, that's not correct, which then I spread all over, so now I guess I got to correct her a little bit. So can you tell me the difference, what I'm trying to know about it, between the federal definition and what you're doing?
The death certificate, an actual death certificate, has to be signed by a physician or pathologist. That is the official record. That is the end of the deal. That is the legally binding medical record. That's everything. The CDC does not have the power or authority to modify death certificates. They can't do that. But what they can do is they can say this person had a positive COVID test and then got in a car crash. And even though COVID is not on the death certificate, they can still count that as COVID related at the federal level. That's something they're doing. But if we actually just look at death certificates, which is what we do, they're legit. That's actually what's on the death certificate. It's not some other made up definition.
That dispels a lot of
absolutely
voodoo comments.
Oh, I hear you. I totally hear you. Well, and I haven't spoken to a single epidemiologist that thinks it's reasonable to have someone die in a car crash and count as a COVID death. Like that just does not make a lot of sense. So worry not. We take our numbers seriously here, and they actually represent true COVID-related deaths. Next slide, please. So a key part of our system is our hospital capacity. So these, at the very, very bottom in pink is Washington County, and you can see a little golden bar at the bottom. That little golden bar is how many ICU beds we have available in the county at this moment. That number is less than 10. So right now, we have fewer than 10 ICU beds available. Next, please. Now, oh, yes.
I thought through all of our situation reports that there are 101 ICU beds available in total in Washington County at any given time. That's the total market. What, if I heard you correctly, you said something along the lines of, with the gold here, there's only 10 now available?
That is correct. Adult ICU beds, as in open, empty, able to take a patient in Washington County specifically only, it's fewer than 10. Now, the question is, how many COVID beds are being taken up in the ICU? So how many COVID patients? We have about 4 patients in Washington County on average each day using an ICU bed. So with our current burden of approximately 4 COVID patients in ICU beds and an open capacity of fewer than 10, that's where we're sitting right now in terms of burden for disease in the county in terms of what kind of influx could we take. Now, you would need to speak to a hospitalist to say if they are comfortable with 9 open beds, but as supervising the medical examiner's office, I can tell you that's 2 car crashes away from being full. So that is not a great number. Now there are if you count the entire state, now we have a regional approach, so we can share beds with Multnomah, they can come over to ours, we can use Clackamas's, that's fine. But in the entire state, there are about 115 ICU beds open right now. Yes, adult ICU beds.
So I'll just observe that this is more startling than I had internalized from the situation reports, which is why I did a timeout there. Big gulp. Okay, I knew hospitalizations were up, and I knew Bend was having a problem.
Yes.
I just didn't realize the problem was acute here in Washington County as well. Thank you.
And that's why I'm bringing the real deal for your information and all your questions. So basically, the take-home on our hospital capacity in the Portland Metro, we have 50 beds open, fewer than 10 in Washington County, and about 6% of our existing ICU beds hold COVID-positive patients. Next slide, please. So these are our hospital admissions. So this is simply the count of people that are going into the hospital each day. On the regional side, that's for Multnomah, Clackamas, and Washington County together. And then on the right-hand side, we have Washington County. There's a bar indicating when we entered phase 1 in Washington County. So our hospitalization admissions are going up. Now, they are not what they were in late March, but that's partially because our health system has figured out how to deal better with COVID patients, and people aren't waiting as long to go to the hospital, but we are having an unfortunate increase in hospitalization admissions in our county, and obviously across the region too. Next slide.
That data is just through June, is that right?
That is through last week. Yep.
Okay,
Yeah, so June 28 is actually the 7, and then the 14 is the week after that, so. Yep.
And as a layperson, it was important for me to remind myself that you're just showing the COVID-related. So
Yep.
we know that hospitals have been able to get back to having their non-essential surgeries.
Yep.
That we've been telling folks, if you're having a heart attack, don't delay, call
Please.
911.
Yes.
If you're having a stroke,
Yes.
similarly, call 911. But more and more people are getting out and about compared to our stay home, save lives, aggressive response back in March into April. So more people are getting around.
Yes.
And as you note, heart attacks, strokes, car crashes, motorcycle crashes, they happen.
Yep, absolutely.
Thank you.
Now, my biostatistician professor always said a number without context is meaningless. And I wanted to show you how our metrics that the OHA is looking at have changed over time. So simply put, green is good, red is bad. The horizontal line is when we entered phase 1. Now, if you eyeball this, I see more red under the line than above the line. But we're going to go through each of these and explain what they mean and what they don't mean. The indicator on the far right-hand side is basically a babysitter indicator, making sure that we follow up with our cases within 24 hours. That's been green the entire time. We've nailed that, so I'm not super worried about that. If that drops at all, it's because we don't have enough capacity. So what I'm going to do now is I'm going to go through each of these and talk about how we flip-flop. So you see uptrend, no trend, up 10. I'm going to actually show you the data, what's happening to get those metrics. Next slide, please. Percent positive COVID tests. Now, this is one that usually confuses a lot of people. So sometimes people say, well, more people are getting tested, so we're going to have more positive tests. Absolutely, that's completely true. That dark gray bar indicates the total number of tests that we're having. Okay, so more people are getting tested, that's good. What we don't want to change is the percent of positive tests. The difference between 6,000 tests with 4% positivity and 5% positivity is just under 450 cases in a week. So that 1 percentage point difference is an astronomical difference in the amount of cases in the county. So this is why we look at the percent positive of our tests. And ideally, we would like this under 5%, and really, really ideally, we would like it down closer to 1%. Percent case increase over time. Now, this is a fun one to math, let me tell you. All right, so this is one of the ones where we've gone up and down and up and down, and the most recent one was green. So what this indicator is looking at is between these bars, which are our case counts, how big is that percent change? As you can see with the red arrow, that is an increase in our percent of cases, right? And if you go all the way to the end, you see that green arrow. So we're getting a downtrend, so it's green, but if you look, our case counts are still astronomically high. So it's not necessarily worth celebrating that little dip if you look at the context of where we have come from. So that's why we go, each time it goes up, we get a red, and if we have a little bit of a blip down, and by the way, this for this next week, it's already gone higher than the 2 bars before. So that's why these flip-flop back and forth every week, and that's why it's important to look at how we're doing over time. Percent of sporadic cases. So when we interview a case, we ask them all their contacts. We ask where they went. I mean, to use a rural term, we bird dog them really hard. I mean, we get all their household informations, anything that they will give us, we ask. And if in the event that a person refuses to give us information, if they were at a party, we'll likely get it anyways from the other people who are there. Sporadic cases mean we could not figure out where that person got exposed. They didn't have a barbecue. They didn't have any sort of point event that we could link to any other case known in Washington County or the Tri-County area. That is not, so the higher the percent of sporadic cases, the more community transmission is happening. So that's why we kind of want to watch that one very closely. So as you can see, we've got the line for phase 1, and every single week, our percent of sporadic cases has increased. So going over our metrics, where we're at right now, the most recent restrictions made by the governor, it's too early to see if those are going to have effect on our numbers. The incubation period is 14 days, so it's going to be a little bit before we can see that. The demographics of our cases are changing significantly. A significant majority of our cases now are people in their 20s. This is not how we started. We started in our elderly and our working age, and now it's switched significantly to younger people. The Oregon Health Authority reports business outbreaks on their website if you meet 5 or more cases. Well, the actual definition is 2, and we've had over 90 of them. So we are having a tremendous amount of business outbreaks, and like Marnie said earlier, this is not necessarily businesses that interact with the public. This is like warehouses and people that are working close together, like on a line. So our businesses are having a significant issue with cases. Our hospital capacity, in my opinion, is getting a little low, and I think that's kind of the deal breaker in all of this, because if our hospitals can't handle what we're going to dish out, then we've got a real significant problem, and if we wait until they're full, it's too late. Because what you're seeing in the hospital today is actually what happened 2 weeks ago. So I would watch that very closely. Additionally, the healthcare system has done absolutely everything that they can. Public health has done absolutely everything that they can. And how and when this ends now depends on individuals' choices.